So this is how I do perineal massage to prevent tearing or decrease tearing of my perineum with pushing in labor.
Okay. So you can do this any time of day that works best for you.
Okay.
But I do advise that you are a little bit warmer. So I like to let people know to do it after they showered or after they've been moving around a little bit. If you don't have time or haven't, showered recently, you can always apply a little bit of heat.
Okay. Maybe like a heating pad?
Like a heating pad or something like even the perineal ones that they have for a few moments, maybe about 3 to 5 minutes or so.
Okay.
Not directly on the skin, over your underpants or so.
Okay.
Now, what I first like people to do, you can do it a couple ways. We're going to start externally first. If you feel like you need to grasp, you can use a little bit of lubricant, water-based or whatever works best for you, and just apply it into the canal a little bit.
Okay, so just at the introitus, you have your thumb and this is me doing it for myself, not my partner doing it for me.
You're doing it yourself.
Okay.
Then you can take either your pointer finger or if you need a little bit more surface area, your pointer and middle finger, and just first apply a little bit of pressure. I usually like people to get a little traction between their fingertips and the perineum.
So no lube on those fingers.
Not on those fingers, not necessarily, because it'll be slippery. You won't get a good traction there.
Okay.
If you're finding the skin is really dry, maybe a small dab of some oil.
Okay,
or
so it's not uncomfortable.
Right, exactly. So you want to apply a little bit of traction. You want your fingers to kind of sink into the tissue. You are not doing this. You're not pushing into the tissue for dear life. You are just applying the surface of your fingertips, getting a little bit into the tissue. Okay. Did you see how it kind of sinks in a little bit? That's
you're using just like the little fat parts of your fingers, not like the tip of your finger. Okay.
So now I usually tell people let that sink in for about 90, maybe 120 seconds. Okay. And have 2 minutes. Now, let's just say that was the time frame. Now, you can start to make gentle circles. Usually, I tell people maybe try anywhere between 15, 20, 30 circles one way, whatever they have time to do.
Okay, that's a full verse of Beyonce with the chorus.
So now, you've done that direction. Now, we're going to reverse it, and you can go in the opposite direction. So that's just the perineal body or the midline. Okay. Now, what we know as practitioners is that the perineal muscle goes from sit bone to sit bone. So you don't have to just stay central. I don't have the full model here, but you want to actually go right adjacent to that and do the same thing all the way across until you reach your sit bone. Now, you're not going to have this huge amount of space. It's probably about that much space, but you want to go into those tissue crevices until you can't go any further and you're right up on that bone. And apply that same pressure in that same circular pattern. You reverse it, go right across to the other side.
Same thing, so, one direction. Other direction.
And that's the external technique. Now, you want to cut it and do the internal technique, or you want to do this one video?
I'm going to do one video and cut it. So if my partner is doing this for me externally, what is my partner doing?
So if your partner is doing this externally, I find that they can do one of two things. Depending on their hand position and how comfortable their fingers get, they can use their same pointer and middle finger, same position, same technique, and apply it this way. Or if their thumb is easiest, they can apply their thumb into that space. Just making sure that they are aware of how much pressure they're giving, and you'll tell them that, obviously, because again, when someone's doing something they're not really familiar with, or against someone else's body, they may get a little bit more firm.
And it's not supposed to hurt.
It shouldn't hurt. This is just a very gentle technique. Like I said, you can go all the way across. It shouldn't take more than maybe 5 minutes. I would say maybe 10 minutes if you really want to be a little enthusiastic, but it doesn't have to take all day.
And I'm doing this once a day for 3 to 10 minutes, ideally.
And then if like on the short end, maybe 3 times a week.
So now we're going to do internal perineal massage to prevent or decrease the likelihood of tears during pushing, which I think a lot of women and birthing people are really afraid of. Understandably so.
So if you're going to do the internal portion of the perineum, I like you to use lubricant. You don't want to use copious amounts, just a little bit. So you can use water-based, you can use oil-based, whatever works best for your tissue. So again, if you're doing this on yourself, you're going to you're going to need to use your thumb. You're not going to probably have the ability to turn your hand in this direction, so you're going to use your thumb.
Okay.
Now, the perineum can be a little thicker on some people.
Okay.
So I want to say you probably want to get about right here with your thumb into the canal, to that line. So you're in the canal, right up against the perineum. And first, just apply a little bit of downward pressure. Just a little bit.
Okay.
You hold it there. And I tell people again, you want to make sure that you're giving the tissue time to adjust to your body temperature so that the tissue can soften. You're not trying to dig into the tissue for dear life.
Okay.
All you want to do is just apply a little bit of pressure. And I usually say about 1.5 minutes, 2 minutes or so.
Okay.
Let's just say it's been that time. Now, what you can do gentle, it's a couple of different techniques. You can do gentle scooping, like stretch and pull.
Okay.
Can you see that? So stretch and pull. Oh, don't cause prolapse there. All right, pull that back. So stretch and pull.
So you're pushing down and then pulling out.
Yep. Very, very gentle.
So push down, pull out. Okay.
And let's just say you want to give it a little bit of rest for a second. You go right back into it again. Stretch and pull and hold.
Okay.
And you can do that all around the lower entryway of the introitus.
Okay.
You can.
I mean, it all makes sense.
My model wants to fall apart here. All right. Same thing, other side. So you kind of want to go all along this area. I would say all along this area, just so that everything is getting nice and soft and supple.
Okay.
Now, another thing you can do is try to grasp with both fingers.
Okay.
So on the inside, you would have your thumb. But on the outside, you want to try to grasp the lower part of the perineum. Okay. This one can get a little tricky because sometimes you may find that you're going to find your anus really close there. Yeah. You're not trying to be in the anus. It's right above. Okay. Okay.
Because everybody's perineum length is different.
Absolutely. So you want to grasp this tissue. It feels dense. It feels kind of thickened. It shouldn't feel like you're just grasping skin at the top. It should feel like some dense tissue. So let's just say you grasp that tissue and you have the tissue in between your fingers. You can apply that same technique. Apply pressure, hold it 1.5 minutes, 2 minutes or so. Then you can apply movement. You can do that scooping technique that I showed you previously where you pull away, or you can even do like circles with your fingers, kind of like doing like this. Okay. Okay. So circles. You can do pinch, holds, and pulls. Basically, just applying like a gentle massage technique all along that lower entryway. Yes. Okay.